Our presentation topic is Don't Share a Bed with Your Baby by Sydney Toribio and Allison Milton. This case is explaining the autopsy that a forensic pathologist took, which was of a 3-month-old infant that had been suffocated and basically squashed to death through co-sleeping. So this 3-month-old infant had shared a bed with his mom and 6-year-old brother, and in the morning his face was face down against a pillow, and this had led to blood pooling out from underneath the baby's face and his abdomen, which led to his death.
So next is the issues that come with sleeping with an infant, and this also includes medical terminology we used and found. This includes asphyxiation, also known as suffocation, and this is basically when the body does not get enough oxygen, which can cause difficulty breathing or wheezing or even death. So asphyxiation can occur when something like a pillow or an adult's arm covers the baby's face or nose. Next is strangulation. So this is when blood supply to the body is cut off or reduced. This can occur when something presses on or wraps around the baby's neck or head. Next is entrapment or wedging, and this is when the baby's neck or head gets stuck between two objects, such as like the mattress or the bed frame. However, many can confuse a baby dying from bed sharing with SIDS, also known as sudden infant death syndrome, and we'll be going more over that in the next slide, but these are just some issues that can occur when sleeping with an infant.
Sudden infant death syndrome, also known as SIDS. SIDS is a sudden and unexplained death of a baby that is younger than 1 year old, and it's usually when a cause of death can't be determined, so it's categorized as SIDS. It often does get confused with asphyxial death, basically the suffocation of a baby. Usually that comes from co-sleeping.
However, despite many warnings, people continue to bed share with babies due to articles like the LA Times saying it's okay to sleep with infants when really that's not the case. They list in their article benefits of co-sleeping by mentioning how babies are able to sleep throughout the night. It's easier to breastfeed, and children who co-sleep show more mature social behavior. But is this all worth it for a little mistake of accidentally rolling on top of your baby and suffocating them while asleep? And this goes back to the case of the 3-month-old. The mom had accidentally rolled onto the baby. However, the baby did not die of SIDS. Our evaluation states that the baby did die from asphyxiation, which is basically suffocation.
So the rates about the amount of babies and families that are affected by co-sleeping is around 3,700 babies die each year in the U.S. due to sleep-related causes. In the U.S., the American Academy of Pediatrics is against bed sharing, as there's a high risk to it, such as accidental strangulation, accidental suffocation, and SIDS, because if a parent does co-sleep with a child, they can accidentally go on top of the child without noticing, because many new parents tend to be sleep deprived, so there's a very high chance that a co-sleeping accident can occur.
And here are the resources that we use. Thank you for listening.